The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, the government today has brought in a budget which does not provide for the opening of a single new nursing home bed anywhere in our province. This has come at a time when we know that there are hundreds of thousands of patient bed days in our province's hospitals where the bed is being occupied by people who are not hospital patients at all, but nursing home candidates who are waiting for a placement when there is no placement there for them. Mr. Speaker, I want to ask the Premier what possible account can he offer for himself as an explanation for this decision?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable for the question. Mr. Speaker, as he would know, under the first mandate of our government, we continue to reduce that wait list by over 50%. We've heard from seniors in the province who want to make sure they can stay home and receive that service at home. It's why we've invested again in this particular budget in providing the home care services, the investment we're making to broaden the caregivers' allowances, providing for family members to care for people at home where their loved ones want to be, Mr. Speaker. We're going to continue to work with our partners, and if it requires long-term care beds, Mr. Speaker, we'll continue to build that in the capital plan as we move forward. But we'll continue to work with the hospitals to ensure that the very issue the honourable member is talking about gets addressed. The list he refers to takes in a lot of Nova Scotians, not just those, quite frankly, who are looking for long-term care. The list he's referring to is palliative care, people who can't try to transition home immediately today. They're not looking for nursing home beds, Mr. Speaker. They're looking for loved ones to be able to look for them at home. Those are all of the numbers that he has built around this. Unfortunately, Mr. Speaker, clouds the debate on the reality of what we really need in the system, and it's not helpful to find a common solution that we all believe we deserve.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, the preponderant majority of the people in the category of whom I'm speaking are people who living in a hospital in the province while they're waiting for nursing home placement are in possession of a professional care assessment which says that they are at a point in life when they cannot return to their homes. So to refer to this problem and to these people from the point of view, the perspective of home care is a quadruple red herring and a ridiculous irrelevancy. And so Mr. Speaker, I want to ask the Premier, what does he say to the hundreds of people who are in our province waiting every day for the call to come from a nursing home so that they can make that transition that they're looking forward to, a call which is going to be that much delayed by the decision not to open any new nursing home beds in this budget?
The Honourable Premier.
Again, Mr. Speaker, I thank the Honourable Member for his question. The reality of it, Mr. Speaker, we've continued to reduce the wait list that grew under his government, Mr. Speaker. We've continued to reduce by 50%. The list that he's referring to, Mr. Speaker, has on people who are looking for palliative care. We're investing in hospices across the province. We're continuing to make sure we have those palliative care positions. We also know in some cases people on that list who want to transition to home need those supports in and around them, Mr. Speaker. We're helping to transition them back to home, Mr. Speaker, with the investments we're making. And we'll continue to look at with our partners on whether or not we require more long-term care beds into the future. But the reality of it is, Mr. Speaker, we're responding to the needs that we hear from Nova Scotians and the way that Nova Scotians want us to respond to them.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Not only has the government failed to open a single new nursing home bed in this budget, they've also actively failed to replace the funds that they have taken away from the operating finances of nursing homes in the provinces over the last 2 years, which amounts to around $4 million. Mr. Speaker, I want to ask the Premier, what possible justification can he have for not only failing to open any new nursing home beds, but for also failing to put back the money that he has taken away from the nursing home beds we've got?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable for the question. We had this debate last year, Mr. Speaker. What we did was, Mr. Speaker, is rationalize the administration part of delivering long-term care. We replaced funding back into those nursing homes across the province to continue to make sure that we provide those services. Maybe one of his own colleagues want to answer the question for him, Mr. Speaker. I think if they want to know...
Order, please. The Honourable Premier has the floor.
Mr. Speaker, they couldn't answer when they were in government, so now all of a sudden they get smart.
Order, please. The Honourable Premier has the floor.
Mr. Speaker, the reality of it is we had this debate last year when it came to the administration costs of long-term care facilities. We reduced that. Some of that money has gone back into the food budget and occupational health and safety to respond to the needs of the patients, Mr. Speaker, for our loved ones who are in long-term care facilities. We're continuing to work with our partners to ensure that those Nova Scotians who require long-term care get it, and those Nova Scotians that want to live the remaining years of their life at home, to make sure that we have resources and programs in place to allow them to do so.